Let's begin with the clinical vignettes. So, a 5-month-old baby girl is brought to emergency room because of increased sweating, shaking, chills, and vomiting. Further evaluation showed decreased blood glucose level below normal range. Symptoms started soon after feeding the child. Which of the following enzyme is most likely deficient in this girl? Lactase, aldose reductase, fructokinase, hexokinase enzyme. And last one is a fructose 1-phosphate aldolase B. So lactase is a carbohydrate that is digested by lactase enzyme. This enzyme is present in the intestine brush border. So what happened? This lactose is digested by lactase enzyme, and this lactose is split into the glucose and galactose. So what happened in the lactose intolerance? This lactase enzyme is deficient. So the patient present with the bloating, cramps, flatulence, and osmotic diarrhea after the ingestion of milk product. So next, the finding of the lactose intolerance, the pH of the stool is decreased and the lactose hydrogen breath test is positive because of the fermentation of lactose by bacteria. Next, the treatment of the lactose intolerance, decrease intake of the dairy and milk product, intake of the lactose pill in the diet, and lactose-free milk. So an alternative method to trap the glucose into the cell to convert this glucose into this sorbitol by the enzyme aldose reductase. Next, this sorbitol is converted to the fructose by enzyme sorbitol dehydrogenase. What happened when the chronic hyperglycemia? Then there is increased glucose and there increase conversion of this glucose to the sorbitol. So the excessive sorbitol is converted to the fructose, but there is a certain structures that has sorbitol dehydrogenase enzyme is absent. For example, lens, retina, kidney, and Schwann cells. So there is increased accumulation of this sorbitol lead to the increased osmotic damage to that structures. For example, in chronic hyperglycemia like diabetes mellitus, there is increased sorbitol. So what happened in the lens? It lead to the cataract. And in retina, it lead retinopathy. In case of kidney, nephropathy. Due to osmotic damage and Schwann cells, peripheral neuropathy. So glucose is converted to the glucose 6-phosphate by enzyme hexokinase in a mouse tissue. This glucose is converted to the glucose 6-phosphate in case of the liver and the pancreas cell by the glucokinase enzyme. So this glucose 6-phosphate then converted to the fructose 6-phosphate. So this substance fructose 6-phosphate inhibit this glucokinase enzyme, while this fructose 6-phosphate inhibit this this hexokinase enzyme. So next thing is this glucokinase is induced by insulin, and deficiency of this enzyme, glucokinase, lead to the moody maturity onset of diabetes of the young and the gestational diabetes. So these two things are the high yield stuff related to the glucokinase, gestational diabetes mellitus. So the important stuff again, that this glucokinase is present on the liver and the pancreas, while this hexokinase only present on the most tissue except liver and the pancreas. So now I am going to discuss about the fructose metabolism. So fructose is converted to the fructose 1-phosphate by the enzyme fructokinase. If this enzyme is deficient, it will lead to the essential fructosuria. So in this essential fructosuria, fructose appear in blood and urine. It is a mild disease. So in this, the hexokinase becomes the primary pathway for converting this fructose into the fructose 6-phosphate. Next, this fructose 1-phosphate is converted or splitted into the dihydroacetone phosphate or glyceraldehyde by the enzyme fructose 1-phosphate aldolase B. So if this enzyme is deficient, it will lead to the hereditary fructose intolerance. So the symptom of the hereditary fructose intolerance appear of the consumption of the fruit, juice or honey. This is the high yield stuff. And the symptom and the signs of the hereditary fructose intolerance are the hypoglycemia, jaundice, and the vomiting. And in the chronic cases, the cirrhosis is also the positive finding in case of the hereditary fructose intolerance. So this dihydroacetone phosphate converted to through G3P, which may be utilized in the glycolysis pathway or utilized in the gluconeogenesis. And this glyceraldehyde ultimately converted to the glycerol, and this glycerol is again utilized in the gluconeogenesis pathway. So the treatment of the this hereditary fructose intolerance is decrease fructose intake, decrease sorbitol intake, because the sorbitol is converted to the fructose by enzyme sorbitol dehydrogenase, and decrease intake of the sucrose, because sucrose metabolism produce fructose and glucose. So the right answer of this clinical vignette is a fructose 1-phosphate aldolase B, and the child is suffer from hereditary fructose intolerance. While if this is the lactase, so the lactase, as we know that the lactose intolerance, the child present with bloating, flatulence, and cramps after intake of milk product.